Bismillahirrahmanirrahim. Hello everybody. So here we have a case which stated a 42-year-old woman, gravida 4 para 3 at 37 week of gestation, is brought to the emergency department by her sister after falling to the ground and developing full body twitching and jerking. Her sister says that the patient was unresponsive during the event, which lasted approximately 2 minutes. Since regaining consciousness, the patient has been lethargic and weak. She does not recall falling, but remember being bothered by bright light, suddenly unable to see, and experiencing the worst headache I have ever had. The patient has a history of depression and anxiety but cannot recall the names of her prescribed medications. She also has a history of headache with sensitivity to light, for which she typically takes acetaminophen, drinks diet cola, and smokes a cigarette. Her last pregnancy was 13 years ago, and she says the current pregnancy has been uncomplicated. Blood pressure is 200 by 105 mm of Hg, and pulse is 112 per minute. Physical examination show a tired appearing woman with no neurologic deficit. She is oriented to person, place, and time. Urine lysis show a 2 plus protein. Which of the following is the most likely diagnosis for this patient? So choice A, brain tumor; choice B, cerebral venous thrombosis; choice C, convergent disorder; choice D, eclampsia; choice E, epilepsy; choice F, migraine with aura; choice G, subarachnoid hemorrhage. So first of all, this is a very simple question. They are asking about the diagnosis of this question. So as we already know that there are almost the complete hints in the question to the diagnosis of this question. So the first hint we can go toward first of all we have to see that this patient is come to the office at 37 week of gestation, and she fall to the ground and developing full body twitching and jerking. So this is the first hint. What is the first hint? Full body twitching and jerking. So this is seizure, because the twitching and the jerking is a tonic-clonic seizure, generalized tonic-clonic seizure. So this is a seizure. Now come to the second hint. That where is the second hint? The second hint is state that the patient said that I bother from bright light and suddenly unable to see. And the third hint is the patient experiences that this headache is the worst headache of my life I have ever had. This is the fourth hint. Now come to the fifth hint. Fifth hint. So the fifth hint, on physical examination, the patient blood pressure is 200 by 105 mm of Hg, which is hypertension, and on urine lysis there is 2 plus protein. Let me revise again. This is a simple question. So first of all, where is the hint? First of all, the patient fall to the ground. The patient fall to the ground. Fall to the ground. This is the first hint. Come to the second hint. The second hint is that the patient being bothered by bright light. Being bothered by bright light. Come to the third hint. The third hint is the patient experiences the headache as the worst headache of my life. Worst headache. Come to the 4 number hint. The 4 number hint is hypertension. As we can see that this patient blood pressure is 200 by 105 mm of Hg. This is the fourth hint. Come to the fifth hint. On urine lysis, there is 2 plus protein on the urine lysis. So based on these 5 hints, we can go easily toward the diagnosis of this question. So what is the diagnosis of this question? Diagnosis of this question is eclampsia. Diagnosis of this question is eclampsia, as we can differ eclampsia from pre-eclampsia. So pre-eclampsia include hypertension and proteinuria without seizure. If the patient experiences seizure with hypertension and proteinuria, so this is the diagnosis of eclampsia. So here the correct option is choice D, eclampsia. Why the choice D is the correct one? Because a seizure during pregnancy is always concerning for eclampsia. Eclampsia is the occurrence of seizure in a patient with preeclampsia. The symptom of preeclampsia include hypertension, proteinuria, and is the most common cause of new onset seizure in pregnant patients. Eclamptic seizure are typically tonic-clonic. So what tonic-clonic mean? Tonic-clonic means stiffening and twitching or jerking. Generalized and brief. Seizures are frequently preceded by severe headache. This patient also experienced the worst headache of my life. So this is severe headache, visual disturbances, as this patient also experienced visual disturbances, for example blurry vision, photophobia, loss of vision. Patient typically have hypertension. So for the eclampsia, the diagnosis of hypertension is that the patient has systolic blood pressure of more than or equal to 140 mm of Hg, or diastolic blood pressure is more than or equal to 9 mm of Hg, and proteinuria, but no focal neurologic deficit. So this is the diagnosis for the eclampsia. This is a simple question, an easy question. Now come to the choice A. Why the choice A is incorrect? Brain tumor. As we already know that brain tumor can present with headache and seizure. However, patients from brain tumor are typically have dull and constant pain rather than acute and severe. In addition, a brain tumor would not explain this patient proteinuria. So this is also incorrect. Come to the choice B. Why choice B is incorrect? Cerebral venous thrombosis. So cerebral venous thrombosis can present with gradual onset headache, focal seizure, and focal neurologic deficit. It is not associated with proteinuria. So this is the B number. Now come to the option C. Why the option C is the incorrect? Convergence disorder. So convergent disorder refer to the neurologic symptom that cannot be explained by a medical condition. Depression and anxiety, however, are risk factor, but convergent disorder would not explain this patient proteinuria and severe hypertension. Choice E state that epilepsy. So as we already know that epileptic seizure occur in the absence of provocation. For example, epileptic seizures are more typically followed rather than preceded by headaches. So what is epilepsy? As we already know that the epilepsy is the 1, 2, 3 or 4 time or more than 4 times the occurrence of a seizure, and 24-hour is known as epilepsy. So and the seizure is preceded by severe headache. This patient's seizure occur in the setting of an acute medical illness, that is preeclampsia, and is not considered as epilepsy. So they come to the choice F. Choice F said that migraine with aura. So although migraine headache can be accompanied by neurologic symptom, for example hemiparesis, stupor, coma, vertigo, and ataxia, and visual symptom hallucination, diplopia, blindness. So seizures typically are not precipitated by migraine headache. This one is also incorrect. Now the choice G, subarachnoid headache. As we already know that the subarachnoid hemorrhage, the most common hint in the subarachnoid question is that the patient will experience the worst headache of my life. But subarachnoid hemorrhage typically present as a sudden, extremely severe headache associated with nausea, vomiting, meningitis, and loss of consciousness. Seizures are uncommon but poor prognostic manifestation, usually accompanied by altered mental status and papillary edema from increased intracranial pressure. So this one is also incorrect. Now let me revise again that why the eclampsia is a correct one. So there in the question they totally explain that the hint about the eclampsia. So first of all, which one is the hint that the patient come in the 37th week of gestation? So the first one is the patient fall to the ground due to seizure, which experience full body development, twitching and jerking. So this is twitching and jerking is tonic-clonic seizure generalized. This is the first hint. The second hint is the patient after regaining consciousness. The patient stated that I remember that before the seizure I am bothered by bright light. This is the second hint. The third hint is the patient experienced that this headache was the worst headache of my life I have ever had. This is the third hint. The fourth hint, that the patient on physical examination, the patient on checking her BP, her vitals, the patient has hypertension, which is 200 by 105 mm of Hg. This is hypertension. And the fifth one is on urine lysis. There is 2 plus protein. So this is proteinuria. So the diagnosis to this question is eclampsia. Thank you.